One of the most common side effects of GLP-1 medications is nausea, and I'm going to tell you how to prevent it or manage it if you are planning on starting a GLP-1 or are currently prescribed a GLP-1 and struggling with this common side effect. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician, and I commonly prescribe GLP-1 medications to help improve my patients' diabetes, insulin resistance, and weight management. I see patients virtually through my telehealth Missouri Metabolic Health. So if you live in Missouri and are looking for a doctor, check out the link below. But if you live in other locations, you can still find great information here on my channel. So hit subscribe, and every Monday we will go over a new topic that is relevant to your overall health, but specifically your metabolic health. And today we're going to talk about preventing and managing nausea while on a GLP-1 medication. There are actually 7 steps or strategies that I utilize with my patients to help prevent and manage this side effect. And these are all things that you can do either on your own or with the guidance of the doctor who is prescribing your medication. So I think you're going to find this extremely helpful. The first tip that I have is to start low and go slow. This is a common saying in medicine, and we really follow it for most medications that we prescribe. We typically start at a low dose to make sure that we are allowing the body time to get used to the medication to minimize and prevent potential side effects. And so we use this for medications that treat mental health concerns. We use this for pain management medications, and we use it for GLP-1s. We are always going to start at the lowest dose that is available and then slowly work our way up as tolerated and as needed. Obviously, this is going to come under the guidance of your prescriber because they're the one writing the prescriptions for your medication. But it is absolutely okay for you to ask questions about your medication dosing and frequency. And with all of the GLP-1s, we're going to start at the starting dose and continue that for at least 4 weeks. To give you an idea of some numbers, for semaglutide, brand names Ozempic and Wegovy, the starting dose is 0.25 milligrams for the weekly injection. For tirzepatide, brand names Mounjaro and Zepbound, we are going to start at 2.5 milligrams and increase again as tolerated and needed. Most guidelines recommend increasing every month, but if at any point you are struggling with any side effect, let your doctor know, and that includes nausea. So if you're having pretty frequent or severe nausea, let your doctor know, and we can go through the next several steps to help manage it. But I also typically recommend staying at that dose for a little bit longer to allow your body to get used to that prescription, that dose of having that medicine in its system. And then when we're ready, we can increase it. Obesity and even type 2 diabetes is not an urgent concern. This is not like having an infection that needs the right dose of the antibiotic right away. This is a chronic medical condition, and we have time to address it in a safe and effective and sustainable way. And so that is why we are able to start low and go slow with these medications. So if your prescriber is following that very regimented increase every single month, but you're struggling with side effects, particularly the nausea, it's okay to ask if you can stay at that initial dose a little bit longer to minimize the side effects. Side note, I have many patients that respond at those lower doses. So they're getting significant appetite suppression, they're full in between meals, and we're seeing weight loss at that first dose. And so if that is the case, I'm not going to push them to higher doses just because that is what is listed to do on the algorithm. I'm going to follow what is best for my patient. And if that means staying at that initial dose, then that is okay. And there's no need to push it to higher doses at any specific interval. But at minimum, you're going to want to stay at each dose for at least 4 weeks before increasing to allow your body time to get used to it. So tip number 1, start low and go slow. Tip number 2, and this one is super common. I have many patients tell me this really without even prompting. A lot of people notice their nausea is triggered by an empty stomach. This is particularly important for anybody who tends to skip breakfast. If you skip breakfast, that may trigger nausea. Your stomach may be completely empty and it feels unsettled. And so to avoid that, I always recommend my patients who are on a GLP-1 to have at least a small breakfast, preferably with some protein and fiber in it, to start their day. And they're going to tend to feel much better in the morning and even in the afternoon and evening if they get that nutrition in early. Tip number 3 kind of flows together with tip number 2, and it's to eat more small and frequent meals. Having a large meal while on a GLP-1 can trigger upset stomach, potentially nausea and acid reflux. So what we're wanting to do are sticking to smaller portions more frequently throughout the day. And you're gonna want to at least eat 2 meals, ideally 3, because they're gonna be smaller portions, but we wanna make sure that you're still getting the nutrients that you need to feed and fuel your body. So we're wanting to make sure we're getting enough fiber and protein and micronutrients. And so sticking with smaller, more frequent meals throughout the day will not only help you avoid an empty stomach, but it will help avoid feeling overly full, which can lead to nausea and honestly a propensity then to vomit if there's too much volume in the stomach at one time. Number 4, adequate hydration is extremely important. Many of us do not drink enough water as it is. But when we're on a GLP-1, not only will it suppress our hunger hormones and our hunger signals to the brain, oftentimes that overlaps with the thirst signals, and many people may not feel as thirsty while on a GLP-1. You also feel more full with less food, so there's less volume in the stomach to add water to it, especially during meals. And so we need to really make sure that we're drinking water consistently throughout the day. Another tip along with that is potentially adding an electrolyte drink once a day. Sugar-free electrolyte drink is preferred, and this will allow you to increase your hydration with less volume at one time. The reason this relates to nausea is that when you're dehydrated, it can cause many symptoms like fatigue, irritability, constipation, but it will also trigger nausea. So sometimes the nausea is not a direct side effect of your GLP-1. It may be a consequence of dehydration that is associated with the GLP-1, but again, not a direct side effect. And so making sure that you're staying well hydrated will help prevent nausea and help manage it if it occurs. Number 5, we can sometimes utilize medications to help manage nausea if it is appropriate for you. And there are several different prescription medications that are available if you are struggling with nausea, especially if it's happening the day of or after your injection. If nausea is really a problem every day of the week, then it's not necessarily appropriate to use we call them an antiemetic or a nausea medicine every single day. We need to look at the reason why you're nauseous and address that specifically. So that would be addressing the 4 tips we talked about earlier, as well as the last 2 tips that I'm going to go over in a few minutes. But if you're just needing it periodically, that's okay to have a medication on hand. While I'm thinking about it, there are other options other than prescription medications. Many people get relief from nausea using ginger-based products. Some people feel cooling effects of peppermint. There's also Dramamine and Unisom available over the counter. Just remember, these medications have potentials for side effects. Some of the medications may cause drowsiness, some may cause constipation. So it's not something that you want to use all of the time. These are more as needed in the moment. Number 6 is interesting and controversial. It is changing your injection site from your abdomen to your thigh. I've had several patients tell me that they felt the same positive effects of their GLP-1 when they inject in the stomach or in the thigh, but they had less side effects when they injected into the thigh. Interestingly, and why this is controversial, is that there have been studies that looked at this and they did not see a difference in the effectiveness or the side effects. But it's worth trying, because if you're feeling a benefit, this is not going to be harmful anyway, and a simple fix to manage that side effect of nausea. And then lastly, number 7, if you have tried all the other 6 strategies and you are still struggling on a regular basis with nausea from your GLP-1, then it may be that a GLP-1 medication is not the best choice for you, and we need to think about an alternative treatment plan. I will say that I have had many patients struggle with nausea on semaglutide, Ozempic, or Wegovy, and then later on tried tirzepatide, Mounjaro, or Zepbound, and they did fine on the tirzepatide option. And so if you're on semaglutide and you're struggling with nausea, it may be appropriate to try tirzepatide. But if you're still struggling with tirzepatide, then definitely talk to your doctor about alternative medication or treatment options available, because at that point, we really should be thinking about other options for you. And there you have it. We have 7 ways to manage nausea while on a GLP-1. We want to start low and go slow with the dosing. Avoid an empty stomach, eat small, frequent meals, make sure we're well hydrated, utilize antiemetic or anti-nausea medications, whether that's prescription or over the counter, although we don't want to use those every day. We can try injecting into our thigh, and ultimately we may need to switch to a different medication. I really hope you found this helpful. Please subscribe, please like and share with others who may benefit from this information. And I can't wait to talk next week about a new topic related to your health and your metabolic health. If you have any particular questions you need addressed, please put them in the comments below. I'd be happy to answer. Take care and have a great week.